get at it.
Hey guys, welcome back to Independence Today. And I am Rob.
I'm Maria.
Okay. And we are excited today to have as our guests, we have Lauren Carson, who is the Epidemiology Research Associate at the Erie County Department of Public Health. And we also have John Derlin, who is the 911 Coordinator for the Erie County Department of Public Safety. And we are here today to talk about a concept called the Emergency Needs Registry. Now, John, what is this and when did it start?
So basically what the needs registry is that citizens of the community can submit this information. We put it in the system at the 911 center. When there's an emergency at that location, we're able to relay that information to emergency responders. So anybody that might have special needs, they need extra support during an emergency, we're able to have that information. It actually pops up on the computer screen, and then we can relay that to the emergency responders.
Okay. So an example of that might be that this person is an insulin-dependent diabetic kind
absolutely.
of thing. What are some other examples?
Not being able to have mobility, bedridden maybe, nonverbal.
Nonverbal, I was thinking of that.
Yeah.
Okay.
So even in the example that you mentioned, if a neighbor calls and says, hey, there's somebody laying on the ground or unconscious, and we know in that registry that that person has diabetes.
Okay.
And the ambulance shows up and it helps them to know ahead of time, hey, this might be the problem.
Okay.
During a fire, if we know that the person that lives in the upstairs bedroom is not able to walk, then that would be the place that the fire department would want to check first.
Good, good. So from what I'm hearing, this could potentially save lives.
100%.
Okay, okay. When did the concept start, and is the registry, can it be used right now, or when did it come into, how did all this come about?
Yeah, the registry as a concept has always been in place. So it used to be emergency responders would relay that information back to the 911 center. They would say, we went to this emergency there, we think that you should note this information. Okay, so as a concept, that's always been there. Right now, the registry is active. The health department, the Erie County Department of Health got involved this year, and they were able to do a much better job of making this more of a public thing. So now the public is able to proactively submit that information, whereas it used to be after the fact.
Was there a reason why, now they decided to get involved? What triggered them as opposed to 5 years ago?
That's a great question for Lauren. Yeah.
Okay,
well.
My role exists within our health improvement and preparedness division. So working with some program coordinators who are out doing education and promotion, as well as our public health preparedness coordinators who work very closely with public safety. The work they're doing, and then my job as an epidemiologist is to identify populations in our community that our target populations who have needs that we should focus on, or barriers to access or health of things that prevent them from being healthy or safe.
right.
We had a third of our funding through Title V, which is our maternal child health program, that was actually targeted at children with special health care needs. And I was doing some research of, how do we reach that? How do we reach that population? What's being done? And I stumbled across other counties who were implementing this. And I went and I did our research, and I went to public safety, and they did have a form, as John said, it has always existed. But our goal was really, let's make it more accessible, more available to the public. Let's let people know that this is a resource that they have, and let's, as he said, be preventative as opposed to reactive.
Oh, do you want to talk about the sticker thing that you have made?
In addition, the emergency needs registry is for everyone, all ages, various reasons. In addition to that, this was like a co-campaign that we did it was targeted at children with special needs, and we had a decal to go on vehicles or windows that would alert first responders that someone in this home, in an emergency, they may not be able to respond, they may hide. And this was kind of focused originally on, those intellectual disabilities or cognitive disabilities for children who may not know how to respond or may respond in a way that could actually harm them more, or the first responders who are trying to reach them. Yeah.
Yep.
So we designed the decals for the windows in the vehicles to have another layer of, so you may have an entry in the registry that's alerting them right away, but maybe there's not something, so on your vehicle that's not linked to your address. So you may be driving and have an accident. Well, now they're approaching the car and they see that and they're more attentive to maybe there's a child here.
That's
who
smart.
has-
That's great.
And what are the words that say underneath it when they're like, you may run away, you may not talk, like
Yeah,
that?
you may not respond, may
Yeah.
hide or run away.
Nonverbal,
Yeah.
and then something else too.
Nonverbal or, I can't remember
Yeah,
exactly.
but when the decals are ready, where can people get them?
So they can be, you can call the health department and we can pick them up there. Any of the Erie County Public Libraries, and then the City of Erie Fire Departments. All have them.
Yeah, I'm excited for them. I'm gonna put it in my car.
There you go.
In case of emergency.
And that being said, it was so well received that we kept getting the feedback that, these barriers or these needs, they follow not the child into adulthood. So then we got the response that, well, do we have these for all ages?
Right, yeah.
And so we've been working closely.
Yeah.
Maria's been helping give us some feedback as well, and we've been getting some responses that we could generalize this for all ages. So
That's
that
great.
it's
Because
just,
they have like two hands on there, and you can't tell if it's a kid's hand or adult hand, which is pretty cool. So it's just hands.
Okay,
So,
okay.
yeah. So maybe removing the child
Part
with
of it.
and making it more general for all ages. And we got some feedback from first responders as well, because we want it to work for them.
Yeah.
And they said, really what we're seeing is the hands,
Mhm.
and that's alerting us. And
Yeah.
so that was the most important piece. So it didn't seem like taking the child piece away was
Mhm.
going to,
Be major.
yeah.
Because obviously people have disabilities from 2 to 85, whatever. So it should be for everyone. How does somebody go about getting to the registry to enter their information?
Yeah, there's a couple of ways. There's a QR code that's posted on social media, often on our social media or Facebook, just so you could just scan it on your mobile device, and the form is mobile friendly. It can also be translated into, I think, 5 different languages now.
Wow.
And we did our best to make it very ADA compliant as well.
Good.
And there's also a link, so it's eriecountypa.gov /specialneedsregistry.
And I put that on there too, so hopefully people can
Good.
see it later too.
Okay.
And I think it's important to talk about too, that, some people might be worried about, is this information relevant or not? Whatever you think is relevant, put in there, and then we at the 911 center will filter what the emergency responders need.
Well, it's better to have too much information than not enough.
Absolutely.
Yeah.
And when we were going into this, we reached out to John and Rebecca Long at Public Safety as well, and we said we just wanted their feedback, because we're like, we already know first responders are, overwhelmed and
Right.
and is this, adding too much? Could this have the negative effect? And I think what John said to us that has always stuck with me is like, the more we know, the better, and the
Well, of
more we know, the
course,
safer everyone is.
Mhm.
And-
I don't see how it could be a negative, really. If you know that information going into a situation,
That's accidents happen.
Well,
here
that's
and there,
that's
so.
right, yeah.
I think another piece of this that ties into this is just emergency contact information on your cell phone.
Yes,
So when you have
yes.
a cell phone, you have the ability to add emergency contact information, and there's a little check mark you can say that says share this during an emergency call. And I think that is an easy thing that everybody can do.
Yeah.
So if you call 911 from a landline phone, then that's associated with an address. If you call 911 from a cell phone, it is not associated with anything. So if you add that emergency contact information in there,
Yeah.
it's a simple thing that it provides us at the 911 center a lot more information.
Or if you want somebody else contacted too, put their name in there too.
Right,
They-
exactly, an emergency
Yeah.
contact, yeah.
Yeah, sorry,
Okay.
you just said that. I'm in another world right now, but yeah.
Lauren, could you give us that, I know it's up on there, but could you give us the website again for the Emergency Needs Registry?
Yeah, it's eriecountypa.gov/specialneedsregistry.
Okay,
And it can also be found, it's on the Erie County homepage.
Yeah.
oh, good, okay. Because I always have a concern when something like this is now ready, how do people get to know about it? You know, you were saying about the public library and things of that nature, are there other ways that you can sort of get the word out? And
We have done actually a lot of promotion of this, as often as we can be out in the community promoting it, we are.
good,
Our program coordinator, Mary Johnson, she has been meeting with organizations that serve people with needs to help educate them on it, and we've also been preparing with our communication specialists some packages to provide to other organizations that they could, you know, link it on their website. So when people are looking for resources and they're going to these different organizations, that can link them out to our website to access this. So it's just another way to, you know, get it closer to the people who need it.
Yeah.
well, this is great because obviously, like John had reiterated, it's saving lives. Definitely. Time is, you know what, you know, if somebody, they always say if somebody's having a stroke, you know, the time is, you know, you gotta get the person to the hospital as quick as possible. Well, this is kind of the same thing, you know, if we know this information ahead of time, we can save somebody's life, you know, it's awesome.
Yeah,
So-
the Erie County Department of Health did such a good job publicizing this that residents in Crawford County and Warren County also said, hey, can we use this?
Oh, good.
So they were able to expand that and working with those counties, so now it's actually 3 counties, not just Erie County that are using it.
Good. Hopefully it'll be
Everyone will catch
statewide.
on, you know?
Yeah, it'd be statewide, you know.
Something that should be shared, you know, like everybody jump on it, but.
Is there a way to like contact the governor? Now, seriously, to say, you know, could we make this a statewide thing? Is that possible?
We've
Reached out to
I'm
me.
sure you could. I mean, we've talked about, you know, trying to get to some conferences to talk about how this worked for us and try to promote it on a wider scale. It's hopefully with time.
Okay, great, okay.
Yeah, there are other places that definitely do it. We got a submission just the other day that, you know, because there's an Erie County in New York as well.
Oh, sure,
And
yeah.
they thought that they were submitting to Erie County, New York. So we were able to refer them back
okay.
to, because Erie County,
Okay.
New York does have a similar concept.
Yeah, you forget about
Yeah.
that. There's an Erie County in New York, yeah. Okay, well, thank you, guys. It's really been great. We'd like to thank our guest, Lauren Carson, from the Erie County Department of Public Health. Even though she was late, well, we'll forgive her this
I can't
time,
wait
okay.
to see the decals, man. They're gonna
Oh,
be
yeah,
so-
and then John Derlin from the Erie County Department of Public Safety. Thank you, folks, and it's been a great show. And folks, just want to let you know that December, we will not be here because of the Christmas
There's gonna be
holidays.
too much holiday stuff going on.
That's
so
right.
We'll start up at January.
Yes.
Yep, I think
And
6.
I want to let you know, on a personal note, I am on the good list for
Oh.
Santa. On the other hand, Maria is on the
On
naughty
purpose.
list,
Oh,
definitely. I
nice.
just want all you viewers to understand that.
It's
okay?
better on the naughty list. No, anyway.
Thanks for
Thank you,
having us.
guys. Oh, you bet.
Thank you.